Good afternoon. We are continuing with our lectures on perspectives, theories, and contemporary issues. Today, we are talking about theories. Some of the theories, we will get to know some of the theorists in nursing. We will get to know how nursing started. We will get to know the history behind nursing, the person who brought nursing, modern nursing into being, and we will get to talk a little more about the theory she developed. So before we start with perspectives, I told you last week that every discipline has its origination. And every discipline has its expectations so far as the people that are in are concerned. And so there are certain things that nurses ought to do that will make them the professionals that they want to be. And as student nurses, you have to know who is a nurse. And when we say a nurse, who is expected. I mean, it is not just going through the training that makes you a nurse. It is also developing certain attitudes and living certain attitudes and living to some expectations that makes you a nurse. A nurse is a person who is trained to care for the sick or infirm, especially in a hospital. That is a nurse. A nurse is one who has undergone professional training at a recognized training institution and is licensed to practice. Licensed by who? Not licensed by the Nursing and Midwifery Council. And when we start talking about the statutory bodies in nursing, Nursing and Midwifery Council are one of the statutory bodies in nursing that we will talk about. History and development of nursing. The history of development of nursing started with the belief of the primitive man. And with the belief of the primitive man, health and everything related with it in the olden days was the burden of the man. And if someone is ill, or when there's an outbreak of a condition or a disease in the community or even in the family, it is a responsibility of the man to go fetch herbs and come and treat the sick and give the sick care and attention. And it went on until another generation came, or another stage where we call the status of the woman, where health and everything related with it was handed to the woman, and then the woman was the one who was in charge of the house and taking care of the children and taking care of the husband so far as health is concerned. And so health and everything related with it became the burden of the woman, such that when someone is sick, the woman will go and fetch herbs and come and treat the sick and prepare food for the sick and all of that. And time went on, and when time went by, and then health became the responsibility of the religion. And so when people were sick, they sent the sick to the religious homes. And these religious homes were headed by sisters and priests of the Roman Catholic Church, and some were of other faiths. But basically, the sick was sent to the religious home to be given care and attention. And then now health became the burden of the politician, and now the government and the people making the government now became the forebears of health, such that government started building hospitals and building places for infirmity or infirmaries, and then the government took full responsibility of people who were reported sick, and now health is seen as scientific. Not just in the hands of the politician, but it is also seen as scientific. And major policies and major decisions in health are taken by scientists, and it is backed by empirical evidence. So this is the development, and this is where we have gotten to as a people, so far as nursing is concerned. And everything now in nursing is driven by science. Everything that nurses do is driven by science. And so there is nothing that you can do as a nurse that you should not imbibe certain aroma of science in it. Checking of temperature and the development of thermometer is all science. And interpretation given to the temperature, for the readings and everything that come with it is scientific. Giving bed bath is scientific, because improving personal hygiene will prevent germs, and it's all scientific. The basic nursing that the nurses give are all backed with science. Even certain blankets that you use in making beds is scientific, because there are certain blankets that you need to put in bed just to ensure that a patient who has returned from the theater will be favorable to lie in that bed, or a patient who has come on admission freshly will have it favorable to lie in that bed. So everything that is in nursing and nurses are practicing is backed with science and empirical evidence. And so at no point in time must you do things the way we do it. Sometimes you go to the ward and you ask the nurse, why are you doing this the way you are doing it? The person give you an answer that, here dear, for here, that is how we do it. That shouldn't be the response. You must be able to employ science to explain every procedure and every action you take or undertake as a nurse working in a hospital, or either as a permanent staff or even as a student nurse. Domains of nursing, we have the person. So far as the theories in nursing are concerned, we have 4 main domains of nursing. There's a 5th one, which is education, that we will also talk about. Person. The person is the patient, your client, the person with which you have gone to the hospital to work is the most important domain of nursing, the person. Without the person, there is no nurse. So the nurse must always treat the person as an individual, and also must employ autonomy, which is an aspect or an ethical principle in nursing that asks the nurse or require the nurse to respect the patient. Health is helping the individual to do the things that he would have done if not sick, just as defined by Virginia Henderson, and helping the individual to do the things that he would have done unaided if not sick. They are the very things that you help the individual to do. And also, based on your knowledge, the things that you think and know that the individual must have, that you do for the person, all inure to the healthy living of the individual. The environment is what Florence Nightingale, who is the founder of medical nursing, based her theory on. And with environment, Florence Nightingale believes that keeping a healthy environment means that you are keeping a healthy patient. And for her, her utmost interest was manipulating the environment to help the individual to recover through a reparative process. So she believes that if you keep a healthy environment, the individual, by his or her own immunity, will come out of whatever sickness the person is battling with. And also, nursing is the last domain of nursing, which I have said there's an extra one, which is education. Nursing is the care that you give to the individual, everything from psychological preparation to spiritual preparation, all the very things that is captured in nursing. Education is, as a nurse, you must be able to get education, upgrade your knowledge, and also educate your patients on the things to do and things not to do. and eventually you will help the person to be self-reliant or independent of his health or her health. Terminologies. We have concepts. So far as theories are concerned, theories are abstract ideas that people thought about. They sat down and thought about and developed it, and became accepted worldwide by all scientists. So if you are developing a theory, it starts with an idea that can even be baseless. It may not make sense, but it starts with an idea. And then the idea, you would develop it to an extent that it becomes very useful to the world. So just because it starts with an idea, the idea is what we are calling a concept. So in theory development, an idea which is abstract is called a concept. A process is a series of organized steps designed for nurses to provide excellent care. So a procedural approach of nurses executing nursing care to solve a nursing problem is what we are calling a process. So a process includes assessment of the problem, diagnosing the problem, planning for the problem, implementing the problem, and then evaluating. Models. A model is a graphical representation of a person, thing, or of a proposed structure, typically on a small scale than the original. So a model is a graphical representation of a whole theory. Everything that has been captured in the theory is represented on a small diagram. You are just summarizing the whole idea of the theory in a graphic form to enhance a better understanding. If you take, for example, Abraham Maslow's theory of needs, with Abraham Maslow's theory of needs, you see there's a triangle that comes with basic needs, safety needs, love and belonging, self-esteem and self-actualization. So that graphical representation comes with detailed explanation. Okay, so it is from the detailed explanation that the graphical representation has been made. And that graphical representation is what we call a model. Conceptual model is composed of concept and theoretical linkages between them, which together describe particular relationship between two or more concepts. So if you take a conceptual model, for example, if you take body, soul, and spirit. Body, soul, and spirit are concepts. Body is one concept, soul is one concept, spirit is one concept. Conceptual model is the linkage between body and soul. So you can say that body lives in a soul. It means that you are telling us where body lives, or where soul lives, or so soul lives in a body. So in between body and soul, you have told us that soul lives in a body. So soul lives in a body is describing the relationship between body and soul. So soul lives in a body is a conceptual model. Paradigm is a standard perspective set of ideas. Standard perspective set of ideas. So when you put body, soul, and spirit, and the fact that soul lives in a body and body cannot exist without spirit, all of them together, those ideas is what we are calling a paradigm. So the ideas surrounding concepts is what we are calling a paradigm. Metaparadigm is a set of concepts and propositions that set forth phenomenon with which a discipline is concerned. So a metaparadigm is referring to, for example, the domains of nursing that we are speaking about, the framework of a theory. So if you take the person, which is the client, the health, environment, nursing, it's forming the framework of a theory. So that is a metaparadigm. Okay, it contains concepts, description of concepts, and how a discipline is like, and the real nature of a discipline. That is a metaparadigm. Propositions are statements that explains relationship between concepts. Propositions are statements that explains relationship between concepts, and usually propositions are linked up with conceptual models. Ethics, standard principles that govern a person's behavior or the conduct of an activity. Ethics, standard principles that govern a person or conduct of an activity. So if you want to practice nursing, the things that guides your practice so that you can practice with standard is what we are calling ethics. So if it is ethical for a nurse never to abuse a patient, so immediately a nurse abuses a patient, whether verbal or physical, it becomes unethical. So it is never the case for a nurse to abuse a patient with insult, verbal abuse. That becomes unethical. Or a nurse fail to administer medications when time is due. So medication is set to be administered at 4 p.m. and a nurse who is on duty forgets the medication, and then by 7 p.m. the medication that was supposed to be administered at 4 p.m. has still not been administered. That is tantamount to negligence of duty, and it is unethical. Theory is a set of interrelated concepts that give a systematic view of a phenomenon. Theory is a set of interrelated concepts that give a systematic view of a phenomenon. So a set of concepts that gives a systematic view. It explains a phenomenon, observable fact or event. So sources of nursing theories. We have primary and secondary. Primary sources of nursing theory are documents written by the theorist himself, and then secondary are those written by someone else about the theory. The documents that Florence Nightingale wrote herself are primary source of theory. And then the books that people have written on Florence Nightingale's theory based on the things that she wrote are secondary sources of theory. So levels of theory. We have the grand theory, we have middle range theory, and then we have the micro range theory. Grand theory is very broad in terms of scope. For example, you can have a theory like Kofi is a boy. So middle range theory will make Kofi is a tall boy. And then micro range theory will be Kofi is a fair, tall boy. So grand theory is very, very vague and simple. Middle range theory gives some specifics, but not like micro range theory, which gives much more specifics. Yeah, so grand theory is broad in scope. It represents the most abstract level of development and address broad phenomenon of concern within the discipline. And then middle range theory, theory that addresses more concrete and more narrowly defined phenomenon. It is intended to answer questions about nursing phenomena, yet they do not cover the full range of phenomena of concern to the discipline. Micro-range theory, concrete and narrow in scope, and it explains specific phenomenon of concern to the discipline. So, just as I've explained, grand theory is very, very vague and broad, and middle range theory provides some specifics. Micro range theory also gives more detail, more specificity. Right. So types of theories. We have factor isolating theory. They are theories that describe a phenomenon, and then factor relating theories are explanatory. They are theories that explains a phenomenon or a discipline. Situation relating theories are predictive. They predict. They calculate relationship between properties and how they occur. So it is very predictive. And then situation-relating theories are prescriptive. So it identifies under which conditions relationship occurs. It prescribes under which conditions relationship occurs. So those are the types of theories: descriptive, explanatory, predictive, and prescriptive. Right, characteristics of theories. Theories can be, can interrelate concepts in such a way to create a different way of looking at a phenomenon. Theories must be logic in nature, or theories are logical in nature. So it makes sense. It is not illogical. It is very logical. It makes sense. When you read, you can understand what it means. Theories should be relatively simple yet generalizable. So if you look at a theory in its broader sense, it is very simple. If it works for people living in Ghana, it should be able to work for people living in China. And it should be able to work for people living in any part of the world. So simple, but yet generalizable. Generalizable means that you are able to generalize it. So if it works for people living in Choco, it works for people living in Botiano, and it works for people living in Santa Maria, and it works for people living in the US, Washington. So it's very simple in nature, but it is generalizable. Theories can be basis for hypotheses to be tested. So theories are basis for hypotheses to be tested. So hypothesis is a tentative prediction of research. So once it is predicted that this is what is going to happen, and then indeed it happens, it becomes a test to theory, or it confirms theory. So theories can be the basis for hypothesis to be tested. And then theories contribute to and assist in increasing general body of knowledge within the discipline. Of course, theories add on to the body of knowledge in nursing. Theory can be used by the practitioner to guide and improve their practice. So theories can also help practice, because theories has implication to nursing practice. So if nursing practitioners apply theory to the latter, it helps in their practice. It even guides them what to do in certain professional dilemmas. So, for example, if you know the Florence Nightingale's theory, and the fact that Florence Nightingale theory stipulates clearly that the individual's environment must be manipulated to help in health and recovery, knowing this as a health practitioner, you will be able to improve the environmental conditions of your patient to help improve the health of the patient. Same way when you talk about Hildegard Peplau's interpersonal theory, if you are able to improve your relationship between your patient and yourself, Hildegard Peplau is also saying that it helps the individual to recover faster. So knowing this, and if you imbibe it in your care, you are able to improve your care and improve your practice. Theories must be consistent with other validated theories. It should not be at variance with other validated theories. Theories must be consistent with other theories. So let's look at the key concepts as some of the nursing theorists proposed. So if you take Nightingale 1860, she said that to facilitate the body's reparative process by manipulating client's environment. So her theory was based on the environment. Peplau, nursing is therapeutic interpersonal process. Therapeutic interpersonal process. That is nursing. And then Henderson, the needs often called Henderson's 14 basic needs, is also what she proposed. Abdallah, delivering nursing care for the whole person to meet the physical, emotional, intellectual, social, spiritual needs of the client and family. Orlando, the client is an individual with a need that, when met, diminishes desires, increases in adequacy, or enhances well-being. And then we have Johnson, who also said she focuses on how the clients adapt to illness and how actual or potential stress can affect the ability to adapt, and the rest of them. So let's talk about importance of theories. Theories aims to describe, predict, and explain phenomenon of nursing. Theory. Importance of theory. It aims to predict, describe, and explain the phenomenon of nursing. It provides foundation for nursing practice, just as we have said already. Helps us to predict what we know and what we need to know. Right. And helps to distinguish distinguish what should form the basis of practice by explicitly describing nursing. The benefits of having a defined body of theory in nursing include better patient care. The main exponent of nursing caring cannot be measured. Nursing theorists in their works. So we start with Florence Nightingale. Florence Nightingale, nursing theories and their works. We will consider about 5 nursing theorists, but we are starting with Florence Nightingale. And Florence Nightingale is the first nursing theorist and mother of modern nursing. She was born in May 12 in Italy to a wealthy British family. When she was 1 year old, the family, including an old sister, returned to England, where Florence Nightingale had her education. Her family was wealthy, and so were used to thorough parties, to churches, and also travel abroad. While such life suited the parents and the first daughter was Frances Parthenope Vernet. Florence Nightingale was different. Florence Nightingale was not interested in those parties and churches, but she was very, very she was an introvert person. So Florence Nightingale was a shy person, obstinate, introspective, and very idle. And she excelled in her education, arts, mathematics, and philosophy. But in spite of all, her only desire was to render service to humanity. At age 17, she had a strange mystical experience, which she interpreted to be a call from God to his service. So she then asked permission to work for a few months as a nurse at the Salisbury Hospital. She then, the family disagreed with her request. So at age 17, when she put in the application, the family disagreed. They didn't allow her to go. And that, on the basis that no girl of her age leaves the home except to marry. And also, nurses were regarded as servants with whom no one would like to associate with. So on that basis, they declined Florence Nightingale's request to go and serve at the Salisbury Hospital. Her misunderstanding with the family became wider to a point where she refused to marry a very rich man that she was supposed to marry, but she didn't marry the man, by name Richard Monckton Milnes. In 1843, she passed her 23rd birthday before her parents allowed her to accept nursing profession as a superintendent. In August 1854, there was a cholera epidemic in London, and Florence Nightingale worked as superintendent, where she got most of her experience. So Florence Nightingale started working in 1854 when there was a cholera outbreak, and at the point where she was 23 years. In 1854, Britain, France, Turkey declared war on Russia. The wounded soldiers of France were cared for by Sisters of Charity. That of Russia was cared for by Sisters of Mercy. But the wounded of England were almost completely rejected. In the wake of this, Florence Nightingale volunteered her service, and eventually, with the aid of Sidney Herbert, the Secretary of War, Florence Nightingale and 38 nurses were allowed to sail from England to help the wounded. So when this war happened, the soldiers in England were left with no care. And for that matter, Florence Nightingale volunteered. And the one in charge of war, Secretary of War by name Sidney Herbert, gave Florence Nightingale either 38 nurses to Crimea for them to go and attend to the sick. When Florence Nightingale and her team arrived at Crimea, there was overcrowding. There was no soup, linen, chairs, tables, or lamps. She personally raised funds to purchase supplies that doctors could not supply for the army. Florence put up people to clean up and establish laundry to provide clean linen and uniform for the soldiers. The men adored her, the soldiers adored her, and to them she was the lady with the lamp, because she always even go attending to them and caring for their wound in the dark with a lamp. So they called her Lady with a Lamp. The death rate among the wounded dropped from 420 per 1,000 to only 23. So 420 people were dying in every 1,000 deaths. In every 1,000 soldiers, 420 were dying. And when Florence Nightingale went to start giving them care, it dropped from 420 to 22 persons per death in 1,000. She stayed at Crimea until the last soldier returned to England. She became ill with Crimean fever and could no longer walk. In 1856, she returned to England and was acclaimed the heroine of the Crimean War. In gratitude of Florence Nightingale's achievement in Crimea, the British people raised a fund of £50,000 to establish Nightingale's nursing school at St. Thomas Hospital. So this is the kind of the little history about Florence Nightingale and how she came up, stood up, and then found modern medical sciences. She went to do something different from what all others were doing, and she was able to back it with a theory. She was able to back it with the fact that once she is able to create a conducive atmosphere in the people's environment, they were going to live and not die. And when she did that by manipulating their environment, she was able to decrease death rate from 420 in 1,000 to 22. So Florence Nightingale was able to achieve a lot based on just manipulating the environment. Florence Nightingale described the person as the one that the nurse acted upon, and emphasized that the nurse has in control of the patient's environment. Affected by environment, passive yet has reparative process. The environment was the basis of Florence Nightingale's theory, and then included everything physical, psychological, and social. Nurses are instruments to change the social status of the poor by improving their living conditions. Health. We know nothing of health. This was Florence Nightingale's perspective of health. We know nothing of health. The positive of which pathology is a negative, except the observation and experience. So health is a positive, pathology is a negative. So nursing, she said nursing is nursing has to do is to put the patient in the best condition for nature to act upon them. So you put the patient in the best position for nature to act upon them. And she believed that once you put the patient in the best position, immunity can bring the person from any illness that the person is suffering or may be suffering from. So some of the things that Florence Nightingale did was to improve ventilation and warming, light and reduce noise, health of houses, bed and beddings, personal cleanliness, variety, chattering, hope and advice. So ventilation and warming, she kept air that she breathed pure, or we keep the air that patients breathe pure, open doors, big windows, and all of that to ensure proper entry of air. And then proper lighting. Proper lighting in the extent that, to the extent that the room is well lighted and not darkened. People are able to see well. People are not having sight problems because of prolonged stay in the dark. People are able to walk and see clearly without falling. So light has quite as real and tangible effect upon the human body who has not observed the purifying effect of light, and especially of direct sunshine upon the air of the room. So light is very, very important, and light also helps the individual to get some warmth. Noise making or restriction of noise improve or promote rest and sleep. So control of noise help the individual to sleep well. Cleanliness, bathing of patients on frequent and even daily basis. Nurse should wash their hands regularly. Bed and beddings, keeping the beds clean, free from creases and crumbs, changing soil bed linens, and making sure that the vicinity of the patient is kept tidy. And then health of houses. So badly constructed houses do for the healthy what badly constructed hospitals do for the sick. So if a house is badly constructed, it do for what badly constructed hospitals do for the sick. And so if promoting good environment for reparative process to happen, you have to be in a well spacious room, not overcrowded. The place must be tidy and clean, and it must have bigger windows that, so it is not, 10 people lying on one bed, 5 people lying on one bed. That's not healthy. Food, eating balanced diet. Instructed nurses to assess dietary intake, meal schedules, and its effect on the patient. So Florence Nightingale indicated that one's feelings waste themselves in words, they ought all to be distilled into actions which brings results. So that is Florence Nightingale's theory and what she made so far as nursing is concerned. In short, she is saying that in order to promote health, you have to manipulate the individual's environment, keep it clean, keep it free from noise, give the individual good food to eat, spacious environment, and then the natural body immunity will act on every disease or any disease that the individual might be having, and then the person will recover. So we will continue from Florence Nightingale, and then we will talk about Hildegard Peplau's theory. Okay, so Hildegard Peplau's theory is talking about the interaction between the nurse and the patient. And with Hildegard Peplau's theory, 4 main phases were identified. She said that we have the phase of orientation, the phase of identification, we have the stage of exploitation, and then we have the resolution phase. And with the orientation phase is the field, the patient has felt needs, and seek professional assistance from a nurse. So this is the phase of problem identification, where the nurse has to identify the felt needs of the patient. Orientation, that is the phase of orientation. And then the identification, where the patient begins to have feeling of belongingness. So that the phase of identification is when the patient have the feeling of belongingness and start having some confidence in the nurse, a capacity for dealing with the problem, creating an optimistic attitude from the inner strength causes. Here it happens the selection of appropriate professional assistance. So the stage of identification, the patient starts having some love and belonging for the nurse and start confiding in the nurse. So exploitation, the nurse uses communication as a tool to offer service to the patient. Right, so the nurse uses communication to solicit for information from the patient and also to give back information to the patient that will inure to the good health, healthy living of the patient. Resolution is where the patient's needs are met, have already been met, and then now the nurse will have to terminate the relationship, i.e. the patient has been discharged and so the relationship comes to an end. The patient comes to the ward without knowing the nurse. They have not met before. And so, as a person that you have never met before, there has to be some procedural approach in having the person used to you, confide in you, give information that will be necessary to his or her care. Hildegard Peplau is saying that in the phase of orientation, the patient has felt needs, and it is a responsibility of you, the nurse, to identify those felt needs. And again, with the stage of identification, that is where the patient start having confidence, love and belonging in the nurse, and start laying information, good information that is necessary for the patient's health and recovery. And then we have the phase of exploitation where the nurse uses the communication tool, or the communication as a tool to give care to the patient. And we also have the resolution phase where the nurse has, the patient's felt needs have been taken care of, and then the nurse will have to terminate the care, i.e. the patient is being discharged, and so the relations between the patient and the nurse come to an end in that manner. But in certain circumstances, the nurse continue to keep a relationship even whilst the patient is on discharge, especially when it is a condition that the nurse will have to make follow-up on the patient. So the nurse continue to make follow-up even after the patient has been discharged, until finally the nurse is able to make the patient independent of his or her health. And now the phase of resolution becomes complete. So it is not always the time that phase of resolution happens when on the day of discharge. Sometimes the phase of resolution transcends to even after the patient has been discharged and sent home, until finally the nurse finds it expedient to leave the patient to take care or take charge of his own health. Right, so Virginia Henderson also proposed the 14 basic needs in nursing, and then the first one is breathing normally, eating and drinking adequately, eliminating body waste, moving and maintaining desirable position, sleeping, resting. So breathing normally is giving the individual all the necessary assistance or support to enhance breathing, fresh air, good ventilated room, eating and drinking adequately. She also took some portion, and her theory agrees with some portion, or is consistent with some portion of the Florence Nightingale's theory. Eliminating body waste, moving and maintaining desirable position, sleeping, selecting suitable clothes. So if it is in a warm environment, you know the clothes to wear. If it is in a cold environment, you know the clothes to wear. Maintaining body temperature within normal range. The first 8 agrees with the basic needs of Abraham Maslow's theory of needs. Avoid danger in the environment is more of safety needs. Communicating with others is love and belonging. Worshipping according to one's faith is also love and belonging. Working in such a way that one feels a sense of accomplishment is self-esteem. Playing or participating in various forms of recreation is self-esteem. Learning, discovering, or satisfying the curiosity that leads to normal development. And health and using available health facilities is self-actualization. So she used the Abraham Maslow theory of needs to develop her 14 basic needs. 1 to 8 is talking about basic needs. 9 is talking about safety needs. 10 and 11 is talking about love and belonging. 12 and 13 is talking about self-esteem, and 14 is talking about actualization. Right, so Madeleine Leininger's transcultural theory. She talks about the fact that persons from different cultures behave differently, and so they must be approached differently. So if someone is from, if someone is a Ghana, and another person is from the north, and these two people have been admitted in one ward under your charge, then you are an Achim. You are an Achim dealing with Ghana and a Notna. Madeleine is saying that 3 different cultures have come into play, and you must make sure as a professional to look at each and every person in the culture the person belongs. So if it is a Ghana, for example, you would know that a Ghana, when on a normal day when the person has full appetite, would like to go for certain foods, more especially kinky. And if it is someone coming from the north who is very healthy, and has full appetite, the person would prefer stew when it comes to meals. It is also believed that people who are coming from the north, they have good pain threshold. They are able to withstand pain than people coming from the south. So if someone is from the south, i.e. Ghana, and someone from the north go to do surgery, same surgery, appendectomy, and the two of them arrive to the ward, the one who is a Ghana is shouting that he is in pain, whilst the person who is from the north is lying quietly and not complaining of pain. You must know from Madeleine's theory that 2 persons from 2 different cultures must be treated and seen differently. And so you must know that it is 2 cultures at play, and for that matter, 2 attitudes at play. And you must, as a professional, treat them as individuals, not as a group. You must employ the principle of autonomy to treat them as people, 2 different people coming from 2 different cultures. If someone, coming from the north is admitted to the maternity ward, for them in the north, being in labor and being able to deliver in the home shows that you are a strong woman. If you are in labor and you are hospitalized, they see you as a weak woman. So these are 2 different people coming from 2 different places with 2 different ideologies. In the south, once you are in labor, the first place you think about is to go to the hospital. In the north, once you are in labor, the first thing that you need to think about is to call a traditional birth attendant to come and deliver you in the house. And once you're able to deliver in the house without any complication, you are seen as a strong woman. In the south, once you're able to go to the hospital and deliver with your baby and child in good health, you are seen as successful with your pregnancy. So if you are dealing with such people, such that this person has a different ideology, that person has a different ideology, you must be able to view them as 2 different persons coming from 2 different cultures, and for that matter, 2 different approaches must be used for them. That is what Madeleine is talking about, briefly, about her transcultural theory. Dorothea Orem theory is talking about the art of assisting others in provision and management of self-care to maintain, improve human functioning at home, level of effective. So self-care is what Dorothea talks about. Independent, the individual becoming independent of his health or her health. Activities an individual perform independently throughout life to promote and maintain personal hygiene. So as healthcare providers, we must always make sure that we are preparing our patients towards independence. So if you are taking care of a patient who on admission was unable to bath, and the person has gone for surgery, the person is on analgesic, now pain is minimal, you must be able to, even when you are doing bed bathing for the person, you must be able to let the person assist you. So when you are asked the person to bath the hand, for example, bath his own hand, and then if it gets to the back that the person is unable to bath, you take it and bath the person's back. And then when it gets to the person's leg and they think the person cannot bend over, and then you bath the person's leg for him. But at least the person can brush his teeth. The person can apply pomade to the skin. So you allow the person to do that, and you do not do all of them entirely for the person throughout admission, such that even when the person is about to be discharged, you do not even know whether the person can take care of his personal hygiene or not. So you need to prepare the individual towards self-care, independence as nurses. Right, so that is that with Dorothea Orem. You need to go and read more about it. Then Imogene King's goal attainment theory. Nursing is a process of action, reaction, and interaction whereby nurse and client share information about their perception in the nursing situation. So it is an interaction. So the patient gives an information, and based on the patient's information, the nurse gives care. It's a give and take affair, action and reaction in that fashion. That is what Imogene believes in. And then Imogene is saying that the ability of the nurse to take proper information from the patient will depend on the quality of care that the nurse gives to the patient in that manner. Right. Okay, so Callista Roy's adaptation theory. Callista Roy defined adaptation as process and outcome whereby the thinking and feeling person uses conscious awareness and choice to create human and environmental integration. So this model comprises the four main domain of person, health, environment, and then nursing. So the person is an open adaptive system who uses coping strategies to deal with stresses. So the individual is able to adapt to stress. According to Callista Roy, your ability to adapt to stress also help you to recover. So the different rates at which different people adapt to stress is directly proportional to their rate of recovery. So if you are maladapted to a certain, so for example, if two people are having cancer, and then, for example, let's take someone from the West, a white and a black. The white man doesn't do a lot of superstition, associating cancer to witchcraft. The white man doesn't do that. The white man thinks that, there is abnormal multiplication of cells. And so if I take my medications and take good food and all of that, and listen to whatever the healthcare provider is telling me, I'll get well. And so suddenly the white man gets adapted and adjusted to the situation of having cancer. On the other hand, if it's an African, the person associates, in fact, the person will go for asking from a fetish priest why and what is causing his predicament. Why is it that the cancer came to him and nobody else? The person is failing to accept that cancer is a disease and anybody can get it. Rather, the person is associating it with spirituality. And so the person keeps on brooding over the condition and getting disturbed over the condition. And that alone can kill that person faster than the white man who is also equally having cancer. So Callista Roy is saying that because of these things coming into play, someone is able to adapt, the other person is unable to adapt. Health workers, you must know that an individual's ability to adapt and adjust to a certain disease condition has something to do with the person's recovery. And so psychological preparation is the way to go in helping to assist, support individuals to adapt and adjust to conditions that they find themselves in. The more you are maladapted to your condition, the more the condition gets worse. And the more you are adapted to your condition, the more you recover from the condition. That is Callista Roy. Okay, Jane Austen. Jane Austen's Philosophy and Science of Caring. The philosophy and science of caring has 4 major concepts: human being, health, environment, and nursing. Jane Austen refers to human being as valued person in and of himself or herself to care for, respected, nurtured, understood, and assisted in general of a philosophical view of a person. And health is defined as the level of our overall physical, mental, social functioning. So Jane Austen is talking about basically equipping the individual with knowledge to be able to take care of him or herself, and also the nurse being an authority over knowledge to give the needed information to the patient to take care of him or herself. Right. So we will. This is the last theorist that we are talking about, and so we are done with the theories. Most of them are very, very interesting and self-explanatory, and so I will entreat you to go and read about the other theorists. But we have spoken about the main theorists in nursing and the things that they stand for and believed in, and so I would entreat you all to take frantic efforts in reading all the slides that we have discussed so far, and even read ahead, because when school resumes, we will not waste much time to do our mid-semester and also have our end of semesters done. Thank you.